You'll be very pleased to know, those of you who have relatives in Calcutta, that Silver Star will be holding a camp, a diabetes camp from Silver Star India in Calcutta in the next 2 weeks. We'll let you know when that is. Our guest speaker today is Dr. Mala Dalal, an NHS GP and campaigner for lifestyle medicine in London. She's a practitioner, in fact, in northwest London, working primarily at an urgent care centre, which this year was converted into a COVID hub. She was born in Ahmedabad, in Gujarat, so she might as well be from Leicester, I think, and moved to the United Kingdom in 1987. She studied medicine at the VS Medical College in Ahmedabad, and she's been a GP in the UK for almost 30 years, in fact, over 30 years, during which time she's been a medical teacher and examiner at Imperial College London. Recently, she became interested in lifestyle medicine after learning about the power of plant-based nutrition. I have a question to her on that after she's finished her presentation. A very warm welcome to you, Mala. I know you probably were going off to the temple this evening, but we've held you back for at least half an hour to hear your talk. The normal format is to speak for 10 minutes, and then there's about 15 or 20 minutes of questions. So the floor is yours. We're very interested in your subject, which this week is called diabetes and weight loss drugs. So thank you for joining us.
Yeah, thank you very much for inviting me. I'm really interested in lifestyle medicine. And then as a result, obviously, lifestyle is diet, exercise, healthy lifestyle, and the optimum weight. And as a result, diabetes and obesity, they almost go hand in hand. So it's a perfect subject for me. I'm just going to start with diabetes, what it means, diabetes mellitus, as we know. So diabetes, it's a Greek word, means to pass through. And mellitus, it's a Latin word for honey sweet. So before pre-lab days, they used to test the urine, and it was as sweet as a honey. That's how the name has come through as a diabetes mellitus. So as you know, the type 2 diabetes, or the diabetes we are going to talk about, it's not an insulin deficiency, it's insulin resistance. So I'm sure you are aware, but type 1 diabetes is it's unfortunate, a series of unfortunate events, because it's autoimmune condition which attacks your beta cells of the pancreas, which produces insulin. So type 1 diabetes, which usually happens in the younger people, not always, but usually, and that's because of the absolute deficiency of the insulin, as opposed to type 2 diabetes, which we used to call maturity onset diabetes, is because of the insulin resistance. Now, the pathological agents for the obesity and type 2 diabetes are basically high calorie diet and high fat diet. So it is considered the 21st century, diabetes is considered as a black death of this 21st century because of the poor lifestyle, high fat and high calorie diet. Now, what happens with the diabetes is insulin is required for the glucose to enter into the cells, and so basically carbohydrates are broken down into the glucose. Glucose is then enters into the cells, and the mitochondria and the cell uses that glucose for the energy production and for our day-to-day work. The insulin, it's like a key which allows the glucose to enter into the cell. But when you have got too much intracellular fat and the in between the muscle fat, it almost gums up the door and does not allow entry of insulin, does not allow entry of glucose into the cells. So these extra glucose, or that it remains into the bloodstream, it's called chronic hyperglycemia, or the excess sugar in the blood. Now, if it is not treated, it causes blindness because it affects the eyes. It causes kidney failure because it affects the kidneys, heart attacks, stroke, not to mention neuropathy and circulation, leading to the amputation. So basically, diabetes affects almost every system in your body. And that's why it's the greatest emphasis to control the diabetes. Now, 90% of the type 2 diabetes, which we are going to talk about, type 2 diabetes, they are overweight or obese. Weight loss of even 5% improves their glycemic control and overall cardiovascular and the renal risk factors. Now, particularly, there are two other types of diabetes, three other types. One is called MODY, that is a monogenic diabetes or maturity onset diabetes of young. Here, there is a more genetic basis. So you have a 2 or 3 generation of the first degree relatives. At the University of Exeter, they are very much interested in MODY. It's a one of the subtype. The interest of the MODY is usually people are thinner, younger, and they are not type 1 or type 2, but they have got a genetic dysfunction which does not allow beta cells to develop properly, and as a result they have got an insulin deficiency because of that. And there is another kind of diabetes which is called LADA, LADA, late onset diabetes, late onset autoimmune diabetes of the young. Here again, there is an autoimmune condition which causes the destruction of the beta cells. This is increasing. About 1 or 2% of the diabetes is a LADA. And the last one is because of the pancreatic insufficiency. Pancreas is the gland which produces the beta cells, which produces the insulin. And this happens when you've got a pancreatic cancer, patients with a cystic fibrosis, or excess alcohol when the pancreas is damaged. This is just by the by, just to give you an overview of the different kinds of diabetes, because most of the people are aware of type 1, type 2, but LADA, which is almost considered 1.5, which has got features of bit of type 1 and bit of type 2. And then, as I said about the MODY as well, I am seeing increasingly number of these patients in my practice as well. So as we mentioned, 90% of the people with type 2 diabetes are overweight. So there was a direct trial when they included 300 patients with a BMI between 27 to 45 and aged between 20 to 65. Now, they were assigned to the intervention group and the placebo group. An intervention group had a nurse and a nutritionist, and they got an intense support with the weight loss, with the exercise and the diet. Initially, for first 3 months, they were given very low calorie diet, about 825 to 853 calories in the form of soup or liquid for first 3 months. And then the structured program to introduce the diet gradually, the different, so normal diet, but obviously it's a low calorie and high fiber, plant-based, non-processed food, and the low fat diet. So those, at the end of the 3 months, those who lost 15 kg of weight, 87% of them went into remission. So what they are trying to say in type 2 diabetes, initially we used to say you have got diabetes, but now the conversation has changed. If you lose 15 kg, you are in about 80 to 90% chances you will put your diabetes into remission. That means no diabetic medication, and 80% of those patients even stop taking the blood pressure medication. And those who even lost 5 to 10%, about 68% went into remission. And 5%, those who lost 5%, about 20% went into remission. So even weight loss, as much as 5% is good for your blood sugar control. In some ways, it's not, it's a common sense. You are eating more, so there is not enough insulin, or the insulin, as the result, you have become insensitive to insulin. So if you reduce all the extra calories, obviously insulin sensitivity increases, and then your blood sugar comes down. So this direct trial, as a result, people have realized that importance. The NHS has, as a result, come up with a lot of different strategies like Shape Up. There is a top tier 3 weight loss management program. Exercise as a pill, fasting as a pill, and the behavioral modification. So as the weight loss is very important, this brings us nicely to the weight loss reducing drugs. When you are pre-diabetic, you must have heard about HbA1c, which measures your blood sugar for previous 3 months. So HbA1c of 48 or more on at least two different occasion, 2 weeks apart, confirms that you are diabetic. Between 42 to 47, it's called pre-diabetic. Now, the pre-diabetic, you want to nip it in the bud. So basically, you give them an intense lifestyle modification measures, sometimes metformin as well, because metformin, how it works, it increases the peripheral utilization of the glucose. So your glucose is taken up by your skeletal muscles more. And that's why exercise is very important as well, because it increases skeletal muscle mass and it increases the uptake of the glucose peripherally. So there is less glucose in the bloodstream. In the pre-diabetes, if we do the intense programming, then you never become diabetic. But once you become diabetic, then obviously, depending on what your HbA1c is, but the significant weight, that what the direct trial has taught us is significant weight loss, especially early after diagnosis of type 2 diabetes, is associated with a higher chance of remission. Remissions means no more medications, no more, you have to have an annual HbA1c. But apart from that, most of the diabetes related unnecessary appointments comes to an halt. And most important thing, there is not enough sugar in the blood, so it does not damage your organs like kidneys and heart and brain and eyes and peripheral nervous system. The new class of drug, they are called GLP-1. They are very good because it. You must have heard the latest injection, Ozempic or Wegovy. It's very, very popular, particularly in the States, because it's as good as almost the results on the Wegovy or Ozempic are almost as good as the gastric bypass at the end of the 3 months. Weight loss between 12 to 15 kgs, depending on what strength of the Wegovy or Ozempic you are on. So some of you might be taking an injection called Victoza, which is a once daily injection. They are to be taken subcutaneously, as you are aware. But Ozempic and then is once a weekly injection. There are different strengths, and there is a tablet. The Ozempic injection or a Wegovy, the main substance is called semaglutide. Because they are injectable, some people don't like it. Semaglutide is available as a Rybelsus, as an oral tablet as well. All of them, they almost about 70 to 80 pounds per month, their cost is. But because if you lose the weight and then if you don't become diabetic, then all the complications are as a result avoided. So it's very cost effective, all these drugs. And the latest of this GLP-1 or the new drug is called Mounjaro. Now, how Mounjaro works, it works on GIP and GLP-1. GLP-1 is a hormone which increases the production of the insulin and it reduces the gastric emptying. So you feel fuller much longer. As a result, there is a less craving of the blood. I have seen patients losing about 10 to 15 kg, depending on their commitments, in 2 to 3 months, and they become almost HbA1c goes below 47. The downside of these drugs is it slightly increases incidence of the gallstones with the patients taking these drugs, the injections, because it reduces the gastric motility. It also does something with the bile passage as well. And as a result, you are more, but there is one of the side effects. It's contraindicated in the patient who have got pancreatitis, pancreatic related issues, or medullary carcinoma of the thyroid. Medullary carcinoma of thyroid is extremely rare. And the injections work incredibly well. The other side effects, the most common side effect is severe nausea. Some people cannot tolerate because of the nausea. For semaglutide to be most effective orally, we start with 3 milligram. You take first thing in the morning with as little water as possible, less than 120 ml, and do not eat for half an hour. This is semaglutide orally, or a Rybelsus, as we talk about. The equivalent of that injection is Ozempic, which comes in a 3 strength as well. There are 4 needles and 1 syringe. So you get a month supply you use the same syringe, which has got 4 doses, but you change the needles and you use subcutaneously. That means in the quite superficially into the fat, either on your bum cheek or the lower abdomen, lower tummy. The latest injection is called Mounjaro, as I mentioned earlier, and it works on GLP-1 and another incretin hormone. So there are 2 incretin hormones. So apart from reducing the gastric emptying, so you feel fuller for much longer, it also have an effect on your brain. So it reduces your cravings for the food as well. All in all, Mounjaro has got a weight loss of about 15 kg again, or depends on how committed you are and what dose you are on, but very, very good results. Unfortunately, as a result of these fantastic results, a lot of people, particularly in the Hollywood, they are taking this medication, they are taking these injections to lose the weight when they want to go for the red carpet nights, which is good and bad. The slight downside of these injections is the weight loss is fantastic, but as soon as you stop taking these injections, the weight gain comes back. So what I find it's fantastic when somebody's struggling to lose weight, but along with it, behavioral modification, the diet, which includes a high fiber diet, because it reduces the absorption of the whatever you are eating, and exercise. And exercise in particularly Gujarati community, I find their skeletal mass is quite low. So weightlifting, resistance, and strength and exercises are as important. Some of the Gujarati people, and I'm just not, because I'm a Gujarati myself, I know that they tend to add sugar in everything, which we need to reduce. So high fiber, non-processed food is the most important thing. I'm myself vegetarian stroke, almost not, I'm a vegan, but then despite of being vegan, if one is not careful, you could be eating a lot of fried food, a lot of sugary food, and it can be bad. So I'm talking about plant-based, non-processed food. That should be full of legumes, grains, fruits, rainbow vegetables, seeds and nuts. And at the same time, intermittent fasting has got its place as well. Doing Sombar and Guruvar has got its fantastic effect, because when you fast, body goes into the autophagy. It starts eating its own cells, and it removes some of the cancer cells and all the deranged cells. So intermittent fasting, behavioral modification, exercise, which is not just walking or strolling. Obviously, it's better than completely sitting still. So exercise is a pill, fast plant.